let's get into it. You've been preaching programmatic assessment for a goodish time. So let's start with, can you define or better describe what programmatic assessment is and why it's important now?
Yeah, thanks, Dan. Firstly, it's important to realize that I come from medical education, and so the idea of programmatic assessment, and there are many similar ideas in different domains, but the idea of programmatic assessment emerged there because it mimics so much the process that a doctor does when they diagnose an illness. It's very similar. So I will draw on clinical examples every now and then. What Annika and Helena showed is that modern education is not that linear transactional process. I tell you what you need to know, and then you regurgitate during assessment to see what you have retained from what I told you. But it's a complex interactive process. So what is extremely important then is that we do not apply a reductionist simple assessment, but that the assessment is a part of meaning making as well. So if I were to define what I see as the core aspect of programmatic assessment, it is that you combine information in a meaningful way. Let me explain what I mean. In medical education, there is a typical station-based skills examination. You go into one room, you perform a skill, then you go into a next room, perform another skill. Let's say you perform an abdominal examination and a knee examination. The traditional tendency is to add the scores together and take the mean. So the mean of abdominal examination and knee examination. Let's suppose that your abdominal examination was very poor and your knee examination was excellent. We then conclude that on average, your skills are okay. That doesn't make sense. You cannot add up knee examination and abdominal examination. You cannot tell a patient with abdominal pain, I can examine your knee, but your abdomen, I can't examine. So it makes much more sense to then look at different sources. For example, part of a written exam on abdominal, which also has components on abdominal anatomy, or other ways of exams on which include communication, to see why, to diagnose, so to speak, why that abdominal examination was subpar. Was it lack of anatomy knowledge? Was it lack of technique? Was it lack of communication? Because only in that way can I advise the student what to do to make sure that their abdominal examination gets onto par. That is not just an idea. The literature is full with studies that demonstrate that competence does not generalize across content. The correlations between abdominal examination and knee examination stations are incredibly low, but competence does generalize across formats when it's about the same content. So whether I ask things in a written assessment or an observation-based assessment doesn't really matter that much if the content were to be the same. So it makes much more sense to say, let's combine that information and derive a useful narrative. In assessment, we find that odd. But in clinical medicine, that's what we do all the time. A patient comes into your consulting room with complaints, let's say thirst and frequent urination and fatigue. Then you look and you see poorly healing wounds. Then you touch and you feel that the peripheral pulsations of the arteries are weak or absent. And then you perform a lab test and you get a result of glucose of 35 millimoles per liter. We can easily combine that into diabetes. So the central notion is that triangulation. The second part then is to triangulate, to collect that information on a longitudinal basis, which means that you disconnect assessment moments from decision moments. What we typically do is we have an assessment and there's always a decision, or the assessment is formative and we don't use that information at all. In programmatic assessment, we've got ongoing moments in which we collect information about whether a student how a student is progressing, and we combine that information in a meaningful way. Thirdly, that means that every time we need to make a decision, we can look at the richness of the information and make sure that our decisions are proportional to the amount of information. If we have little information, we don't make high stakes decisions. If we need to make high stakes decisions, we ensure that we have a lot of information. That's basically the core of what programmatic assessment tries to achieve.
Okay, thanks. And so if we look at the triangulation of data points, it seems that we need more times over the course, over the semester, to be able to assess. And even in traditional assessment, we talk about formative assessments, formative activities. So if that's also something in programmatic assessment, that we have a formative assessment, what are some of the other differences between traditional assessment and the programmatic assessment approach?
Yes, there are two differences. The first one is that if you look at traditional assessment, it's inherently reductionist. We have this rich information, let's say, even a multiple choice test, we've got rich information about each of the questions and what mistakes were made and what errors were made or what clusters of mistakes and misconceptions there might be. But eventually we reduce all that information to a score or even a decision pass fail. So we dichotomize that rich information, and we do that over time, and in the end, at the end, we've got 6 or 7 dichotomized scores, and from that we have to reconstitute that rich image of competence, and that leads to arbitrary decisions. Pass-fail scores are always nice round figures. They're always 60%. They're never 58.734% because we don't like 58.734%. So one thing and that reductionism is a problem. Again, Annika and Helena's stories showed that actually it's a complex interactive process. So you can't reduce a complex interactive process. You can't apply a reductionist approach. A joke or a bit of a joke that we use in Dutch is that if you disassemble a bike and reassemble it, you will have again a bike. But if you dissect a frog and glue it back together again, you won't have a frog. It's the interaction that counts. So what you try to do in a programmatic assessment, and that's different from summative formative assessment, is to retain that complexity. The second thing, and allow me to share my screen with you because I can explain that with an example. So
please go ahead.
So here is one of the things that we use in medical education is an observed consultation or interaction with the patient, which is then scored and feedback is given. So often when I visit universities or medical schools, I ask, do you use observation-based, workplace-based assessment? And one of the methods used in there is the mini clinical examination exercise, the mini CEX. And typically I ask, do you use, for example, mini CXs? And then people say, yeah, we've got 6 of them. Okay, so that leads to scores. Yeah, we've got 6 sets of scores. Okay, does it also lead to feedback and learning goals? And invariably people say, yeah, we give feedback and we expect the students to formulate learning goals. And then I ask them, what do you think is more important in modern education, focusing on the scores or focusing on the feedback and the learning goals? Invariably, people say, well, focusing on the feedback and the learning goals. And then I ask them, and which component is summative and which is formative? And then they say the scores are summative. So that's an assessment of learning. That's a use of formative and summative assessment for a certain purpose. What you could also do is say, what we're going to do, you could also say, I am going to make the feedback and the learning goals summative and the scores formative. So the score is formative. Here is where I think you are at the moment in your journey towards the end. And I'm going to give you feedback, or you'll get feedback. And I expect you to have learning goals, and I will follow up that feedback and learning goals. And I want you to demonstrate how you've used the feedback and the learning goals and how you've learned from it. I want you to be able to demonstrate that on the next occasion. Much like when you submit a manuscript to a journal and the decision is a major revision, they expect you to take the reviewer's comments seriously, put them in a table, address them, tell them what you've done, and show in a revised version how you've done that. So if you want to have an assessment for learning, you have to focus on that learning process, which is summative still. So assessment for learning is not just formative assessment. Formative assessment means that I will give you feedback and be happy with it. Assessment for learning means my feedback is not for free.
And how much of programmatic assessment is then assessment for learning?
Strictly speaking, but perhaps a bit stricter than, for example, my colleague Kees van der Vleuten, I see programmatic assessment as a way of collecting, collating, and synthesizing information in a meaningful way. whether you use that to make a more informed, robust, fair decision about a student's progress purely for that as an assessment of learning, or whether you want to use that in conjunction with a student. Again, Annika and Helena really talked about autonomy, or we talk about an agentic student, a student who's allowed and who's willing to take agency over their own learning, but also over their own assessment process. So if you share that information on a regular basis and you share your expectations with the learner on a regular basis, your programmatic assessment is actually an ideal way to steer student learning and to as an assessment for learning, because it's rich in information. If you have a reductionist approach, pass, fail, or grades, or scores, your only means of influencing student learning are behaviorist, punishment and reward. And the problem with behaviorists, and that's where the 21st century ideas come in, the problem with behaviorist drivers is that once you remove the reinforcement, or you discontinue the reinforcement or the punishment, the behavior fades. What we want to instill on our students is that they continue to learn and have the agency and the ability to assess, to collect information and to self-assess and to reflect and to set goals for future learning after graduation. When I studied medicine and I graduated, it was fair from the medical school, it was fair to assume that I would have been equipped with all the knowledge, skills, problem-solving ability, attitudes, what have you, to last me for the rest of my career, bar some updating. New drug, you have to learn about the new drug. But basically, the assumption was that the relationship between doctor and patient was not going to change. Doctor knew everything, patient knew nothing, doctor called the shots. That was the idea. That's no longer true. Patients have access to a whole world of knowledge. They will have done their homework, and they either have a lot of relevant information or they think they have a lot of relevant information, but the dynamic in the consulting room has absolutely changed. So what I would need to do is reinvent myself, reinvent my role as a doctor. And that's what we expect of our future graduates. So that bringing that information to the student and working with the student to make sense of that information and to actually action on that information is an essential component.
Okay. Looking at the doctor and their patient, now we have Google Doctor. I think it's a very different relationship, but our students today have all sorts of different affordances. How do those different, for example, digital, internet, social infrastructures that we're now part of, how do those maybe necessitate programmatic assessment more than the traditional methods?
I would say, but hey, I'm not completely neutral, but I would say absolutely. So our students have affordances which are unprecedented. They have the affordance of, for example, being part of multiple communities all over the world, to communicate at different levels. I'm sure that there are people who are quickly flicking off an email now whilst at the same time being in this conference. So we communicate at various levels and with their various means. They can be part of knowledge creation collaborative. When I'm in a tutorial group and I'm accessing Wikipedia, I'm actually in two knowledge creation collaboratives. But also the modes of creation. We're using a sort of podcast style here, but a tutorial, Facebook pages, Insta pages, what have you, videos, moving PowerPoints, etc. There's so many more means of creation than when I was a student. It was basically paper and penciled assessment. We need to incorporate those affordances because the affordances have also allowed the students to access information, to access knowledge. If I type in development of the placenta in Google, I find 15 beautifully animated videos about the development of the placenta. I don't have to sit in a lecture theater listening to a poorly held lecture on the development of the placenta. So there is a power shift. There is a shift in the power imbalance or the hierarchy imbalance between the student and the teacher. And they're at a much more equal level. Education has to reflect that. And like Annika said, she went to this school, this high school, where this was recognized and was institutionalized and enacted, and then come to university, and it's a step back in time. And I think we can't afford that as universities or higher ed organizations to force our students to take a step back in time.
I think you're right. I want to talk about one more aspect of programmatic assessment, mentorship. Now, this is also something that happens in traditional course design and setup. Are there aspects of mentorship which are particular to programmatic assessment?
Yeah, I always, if you look at the various programs that use programmatic assessment around the world, then they typically use three types of words. One calls it mentors, the other one calls it a coach, a learning coach. We at Flinders call it a learning coach. Some in Maastricht call it the counselor. The traditional mentor has a bit of a pastoral aspect. The coach in programmatic assessment is really a coach. It's a kick you behind type of coach. So the role of the coach is to help the student become the best graduate, best professional, in my case, the best doctor they can be. And that's where the whole idea about what constitutes quality of assessment is different. Traditionally, and I like my psychometrics as much as the next guy, traditionally, all our psychometrics are based on making differences or finding differences between people. If you have a class of people, of students, and they all score 100% on your test, and even if the test is relevant and difficult, they all score 100%, you cannot calculate a reliability. That would be a division by zero because there is no difference between students. So all our thinking about assessment is always about telling people apart. In medical education, that's not relevant. You cannot say to a patient, yeah, my performance with you was subpar, but I'm still better than my neighbor. That is irrelevant. So the only thing that's relevant is to use the assessment to give the student information on how to become the best doctor they can be. And of course, we're in a bit of a luxury position in medical education because medical students on average are hardworking, intelligent, highly motivated, high achievers. So why would we set up a system to find somebody who's not intelligent or motivated or a high achiever? Why would we waste all our money and time on finding that bad apple that doesn't exist or is so rare that I have to demotivate a lot of other students in the process? So we'd rather focus on that coaching, like a sports coach tries to make you the best athlete you can be. A coach in programmatic assessment tries to make you the best graduate, the best professional you can be.
I see. And also thanks for differentiating between the nomenclature there, coaches, counselors, mentors. I think it's very odd that if I think about my coach or my mentor back in my education, I have a very different image than if I use the word coach as in a football coach or a dancing coach, because the sort of interaction, the intensity of the feedback that you receive is perceived to be of an entirely different level.
Absolutely.
So
yeah.
I want to actually go back to something you were saying about data and reducing data, and where we have arbitrary scores, then we lose the bigger picture. And a example from your colleague, I believe, was that more data points is like more pixels, more resolution for a picture. But then my question becomes, doesn't having more data points make it more difficult or time consuming for faculties to assess or to judge competencies?
Yeah, it does. I think it also takes more time to create a Mercedes-Benz than to create a cheap car. I'm looking now from a university perspective. Yes, it would be an investment in staff and in quality of staff, because you need assessment expertise, you need people who are trained. But the question is, do you want to be Mercedes-Benz or do you want to be a cheap car? If it's about quality, if it were about investing in quality of research, universities wouldn't think twice. But typically, if it's about investing in quality of education, they think very quickly becomes too expensive. Your moneymaker. Education has a positive return on investment. Research generally makes a loss unless you have something which is beautifully patented and brings in a lot of royalties. But generally, producing research is creating a loss. So that's one thing. But there's another thing, and I think that's so. This is just a matter of where you want to invest your money in your organization. Do you want to do the traditional thing and saying we're research intensive, or do you want to do the forward thinking thing and saying, well, the future lies in education? So that's a statement. The other thing is that you may struggle with larger number of students. You may struggle to find actually people who can be trained to be good coaches. That's something that we found in the different places at which I work, is that you need to handpick your coaches. You need to train them and keep them trained. You need to build communities of practice where people exchange their difficult situations and learn from each other. And not everybody is cut out to become a good coach. If you've got large numbers of students and you're in a situation where beggars can't be choosers, that's an issue.
Thanks. And especially with communities of practice becoming more of a thing, I've heard also in the Australian region, it's going to be interesting to see what use cases instructors can bring forwards to showcase why it is maybe better to focus on quality, to have a Mercedes-Benz as your final outcome rather than pushing large numbers of students through a...
Yeah, well, 15 years ago, I would have easily said that that's not an issue and you can choose whatever you do because there is no competition. But I think in the modern times, there is a lot of possible competition from non-higher ed organizations.
Exactly. All sorts of certifications and other places. We were talking earlier about the other infrastructural, educational affordances, how easy it is to, if I need help for something, look for a video on YouTube instead of having to talk to someone who's an expert on the subject or be part of a network. So a changing landscape.
No, absolutely, Dan. And that's only one of the things. I mean, what Clay Shirky calls cognitive surplus. So the drive that we all have to contribute to the knowledge of others, apparently, even for free. I mean, if you have a lot of followers on YouTube, you make some money. But most of these instructional videos are made by people who just want to share their knowledge. A couple of months ago, my wife asked me to replace the battery in the electronic key of our car, and I had no clue. So I went online and somebody made a 15 to 20 seconds instruction video without even a voiceover, just showing how to change the battery in that e-key for that car. But that's one thing. The other thing is that we live in a society where what Rachel Botsman calls distributed trust. So we used to have trust institutionalized, and that's what schools and universities work on. They're institutions which are trusted to give quality education. And therefore, if you get a piece of paper with their name on it and some marks and signs and seals, that instills a trust in your education. And that's probably not going away, but there are going to be different ways of establishing that trust. In the old days, when I wanted to go to a fancy restaurant, I used the Michelin guide, which was based on the institution Michelin, two people who went to a restaurant twice and wrote something, their expert opinion. Now I go onto Google reviews, look at the top reviews, bottom reviews, look at how the restaurant has responded to the bottom reviews or the good reviews. And I make my decision whether I want to spend my money there or not. So I'm basically now, instead of putting my trust in an institution like Michelin, I'm now putting my trust in a distributed community. The third thing is that we've had a change of how we see knowledge. Traditionally, certainly in the time when I studied, knowledge was seen as something that the expert had and the non-expert did not have. So the education model was based on, I have the knowledge, you don't have the knowledge, you pay me money, I give you my knowledge.
The transmission model.
The transmission model. And the risk is that with technology, we replicate that transmission model, but now in a technological guise. And Microsoft has tried to do that with Microsoft Encarta. You might remember that, the encyclopedia, traditional encyclopedia on a CD-ROM. And then Wikipedia came along and Microsoft Encarta was done. Because Wikipedia operated on the notion that knowledge is not something that the expert has, but something that we co-create. We co-create knowledge. So modern education, and again, the stories of Helena and Annika are beautiful examples. Modern education is about co-creation of knowledge and not the simple transmission or linear transmission model. The linear transmission model is easy. I can record a lecture, you listen, now you know, but you cannot record the coach, pre-record the coach. That's an interaction. And where that interaction is going to take you is unpredictable. I always tell the doctors, if somebody enters your consulting room and I'm going to ask you, what are you going to say after 2 minutes and 45 seconds? Any doctor says, I don't know. During history taking, I don't know, but they'll wing it because that's basically, as simple as it is, a complex adaptive process. Modern education is a complex adaptive process, and the assessment should be constructively aligned with that.
Thanks, Lambert. I have one more question, which I think we have time for, which I'm dying to ask you and everyone involved in educational and pedagogical research, which is what relationship you think educational technology should have with the development of programmatic assessment?
Actually, I'm hoping that you will, because universities are not doing it very well. If we rely on the coach and the students to engage in this meaning-making developmental process, the last thing we want to do is bog them down with all kinds of admin tasks or chasing forms or logistics or poor learning management systems, etc. So EdTech can play an enormous role in supporting that process. But the other last thing that we don't want is a one-size-fits-all product with a lot of marketing being shoved down our throats. We're not looking for that. Nobody's looking for that. And if you do that, you will be behind the 8 ball as well as EdTech companies, because the problem with what we see is our students use all kinds of freely available software and social media to build their own informal curricula as well. And their biggest problem with standard learning management systems is that they are updated once a year, and then big updates, and they have to relearn again, whereas social media update in small steps, and students find that easier to adapt. If you embed your EdTech work in the organization in which you want to work, and you have that embedded co-construction or co-design, there's a huge role for EdTech.
Thanks very much. I wonder if we also have a bit of time to talk about dangers of EdTech and how we shouldn't forge a relationship together. But we're also waiting on some questions from the audience, which we'll post to you soon. If you have any other more thoughts on that relationship, now's the time.
I can kick in an open door, and everybody knows that. As soon as you use EdTech to replace the human interaction, you're doing it the wrong way. You need to support and augment and strengthen that human interactional process.
Thanks. I'll read out the first question from an anonymous user here. Instructional designer here. I'm curious about how my team can support faculty to increase their self-efficacy and comfortableness with teaching online and empowering learners to choose their own learning path.
That is very much dependent on the culture in which you work. But starting with raising awareness is an important point. People sometimes don't know that they have a problem. So raising awareness, working with the people to make them understand that there is an issue to be addressed. I typically find that in any situation, saying that their teaching is not good is unproductive, because then you get a yes, no, or saying that current state of education is not good, or the state of assessment is not good. You get into a yes, no discussion, doesn't work. But focusing on how can we improve, how can we adapt to what you see in terms of modern developments, how can we adapt to that? How can we move forward as an organization is typically a better narrative. How that works specifically depends on the culture in your organization. Is your culture risk averse, or does it embrace risk? Is it process oriented? Is it people oriented? Is it internally focused, externally focused? All those things are important considerations in how to get people on board.
Thanks very much from that. We've got another question here from Sergio Sanchez Padilla. And how do we create online communities of practice that feel relatable? How do we achieve cohesion within a community? That's a big one. It's hard to connect in a meaningful way with people when we don't really share a deeper experience of life. How do we achieve it online? I think this is a very widely resonating question. Any thoughts here?
I wish I had. I find that a very challenging issue as well. I know that the working online and communities of practice work much better once you've had face-to-face contact. But how to establish that online, I don't think I've got a silver bullet suggestion here.
It's certainly an ongoing consideration, not just in these past couple of years, but I think educators everywhere have struggled with this online component.
If it is simply about exchanging knowledge and insights, that will work. you can work on that. But if it's about the other aspects of education, so the partnering, the nurturing, the enabling, it's much more difficult. And I specifically find when I say nurturing, the aspects, and again from medical education, the aspects of allowing people to deal with not knowing and uncertainty and difficult decisions and difficult ethics, those are an integral part of becoming a doctor. And how do you, I wouldn't know how you build communities of practice online for that.
Yeah. And another point that just came to me when we're talking about also the doctor-patient relationship, the teacher-student relationship, and how those relationships are really changing in their trust and feelings of authority and transmission. It seems to be a very different situation now than even a few years ago. Something that I've had has sometimes been an effective practices for instructors who are trying to cultivate interaction and engagement online is post something personal, share something about your story, how you got here, how you're feeling about the environment, the context, and that makes it more of a shared experience. Is that something that you've also come across?
Yeah. Absolutely. And the other thing is be comfortable as a teacher, be comfortable in not knowing and being uncertain as well. So be fair and tell your students, I don't know this, or wow, your information is actually better than mine, or that's a great input that you brought. Even sometimes when it's not entirely the case, but even then it shows your own vulnerability, and it shows that you want to be a partner in that process. So it's sometimes more on about the feeling that you communicate than the actual wording of what you communicate. Something I like to do, we've got online courses, and it's something that I like to do very much is bring people in and sometimes post things and make myself vulnerable. That's a very Dutch way, zich kwetsbaar opstellen, but make yourself vulnerable and say, hey, I don't know this. Does anyone have an idea?
Certainly a different sort of relationship that I'm used to from my educational experience, but this is all about an attitude shift. We had another comment from Andrew Ryle. I hope I'm pronouncing that right. I assume related to our discussion about the implementation of programmatic assessment among faculty. Andrew says, I think the question is, can governments afford to pay for the huge added faculty or stopping most underqualified students?
Oh, what was the aphorism again? If you think education is expensive, try ignorance for a change. That's I'll give you an example. So why I think the financial question needs to be put into perspective. Well, I looked at the finances in our faculty and what is invested in research and what do we get out of research in dollars, and what do we invest in education and what do we get out of education. Well, the investment, the staff investment, and I'm not even talking about infrastructural investment, but the staff investment in research is 3 to 4 times as big as the staff investment in education. And the profits, the dollar income is from research is about 2/3 of what education generates, half to 2/3. So, and then the research model is interesting. So I do my research paid by taxpayers' money, and then I submit my manuscript, and then the reviewers look at it, paid by the taxpayers. Then the editor, I've been an editor for several journals, they work for a rat's fee. And then when your paper gets accepted, your manuscript gets accepted, you have to sign a copyright release form. You're no longer owner of your paper, and it gets published. And then the university has to buy a subscription with taxpayers' money to get access to my work. And they've taking care of all the infrastructure and all the HR associated with it. So all the overhead. So all the overhead, the original work, the quality assurance, and the access to the information is paid with taxpayers' money. And then we call that generating income? Nah. So if we had a problem with governments and paying, then I know different areas to target.
Thanks for addressing that, Lambert.
Sorry.
And thanks for answering all our questions as well. Yeah, I think we're both interested to see how the future of assessment is going to take into account competencies, mentorship, feedback, accountability, and hopefully, ultimately, fairer practices of teaching and learning.
One thing which I would like to defend all the time, this approach to assessment is not just a fad or a hype. If you were to ask me for the literature to defend and to support all the decisions, I could give you pages and pages of literature. There's a strong evidence base for what we're trying to do.